Okay, welcome to Module 8, Understanding and Managing Diabetes Distress. Now, this presentation aims to educate individuals living with diabetes about diabetes distress. We'll explore some of the symptoms, offer management tips, and emphasize that you are not alone and that it's normal to express distress when managing diabetes. Now, I just want to say before I go on, you know, they don't really talk about diabetes distress too much when you're diagnosed with diabetes, or maybe those who have been diagnosed with diabetes for several years, 10, 20, 30 years, and you never really heard of diabetes distress. But diabetes distress is a real thing, and we're going to share what that is. Okay, I will go to the next slide. What is diabetes distress? Now, you see here emotional burden, because diabetes distress is the emotional burden of managing diabetes. Now, when you think about managing diabetes, there's so much that goes on when you're managing your diabetes. You have to constantly worry about every time you eat how it affects your sugar, or then you have to test your blood sugar. But now they have Dexcom devices like that where you can check it on your phone, but you constantly reminded, hey, it's high, hey, it's low. And sometimes you may not feel good. You eat something, your sugar rises up, so you kind of panic. Then so you're constantly in the state of it could be start to be very distressful. And sometimes people can get so distressed that they just say, forget it. I'm going to eat whatever I want. I'm going to stop taking my medicine and think that's going to help, which is not. But when you're distressed and have diabetes distress, this can be emotionally burden for you, right? And so the next one is not depression. So some of the symptoms of diabetes distress can overlap with clinical depression. And so that's why it's key to, when you speak with your primary care doctor or your medical health professional, mental health, you kind of talk to them about it. Like they say, what's going on? And so most likely they'll say, okay, what is your sugars looking like? And when do you start feeling these? Is it sugar high? Is it too low? And then they start to see signs with maybe this is not depression, but it's diabetes distress. Okay, so this is a common experience, like I mentioned earlier, and it affects half of all people dealing with diabetes. So diabetes distress. Now, some of the symptoms of diabetes distress is worry. Again, constantly worrying about blood sugar levels and complications, right? You're like, oh my gosh, if my A1C gets above this for a long period of time, I can get kidney failure. I can get eye problems. I can get amputation of my legs. I can get diabetic neuropathy. I can have a stroke or heart attack, all these things, right? You start to worry. And then also frustration. You feel frustrated with the demands of managing it, right? Constantly check your sugar. Or sometimes you have people, we call them the diabetes police, right? They mean well, but then sometimes if you're going out to eat with them, you think should you be eating that, or shouldn't you do this, shouldn't you do that? And you kind of get a little irritated because it's overwhelming, and it's like, it's just basically overwhelming, taking over your life, right? So it can be frustrated. And then number 3 is burnout. Experiencing burnout with a lack of motivation. Like I mentioned before, the burnout could be the doctors are calling you, hey, we need to get your A1C. You guys know what I'm talking about. Check your A1C, come in and check it, and then you're like, you don't feel like going. Or they're like, you haven't picked up your prescription because you stopped taking your medication. Or you picking up your medication, but your A1C is creeping up. So they're like, what's going on? Because you're not taking your medication. So it's not that you don't care about yourself nor your health, but it's a it's burnout, right? And that's part of diabetes distress. So those are some of the symptoms of diabetes distress. Okay, so the next slide, why diabetes management can cause distress. Well, for number 1, like I mentioned before, because you have to constantly monitor your blood sugar. And it's very important. But you have to do this every day, and it can be draining and get tired, right? You can get tired. And number 2, lifestyle adjustments. You have to make lifestyle adjustments like diet and exercise, and that can be tough. That is one of the hardest things for people to do. Is not exercise, right? It's really food. One of the hardest things is changing food. And I don't really like to say diet, but it's really, you have to change. You basically have to change the way you eat. It's a lifestyle change, right? So that's tough. And then also the fear of complications. The fear of complications, your long-term complications, which could be getting on dialysis again, heart attack, stroke, going blind. Those things are, could cause fear. You fear those complicated things. The next slide, you are not alone. Many people with diabetes, they experience distress, like we mentioned, right? So what can help you also is joining support groups or online communities. They have free online communities and support groups. Talk to your local, your primary care doctor. They most likely can give you a lot of information locally, or go to the Diabetes Association, and they have information on groups in your area. And then also sharing your feelings can help, so you won't feel isolated. Express them to your family and friends of how you're feeling, and tell them that you need support. Sometimes we go through things and we're just afraid to tell other people because we may think it's a sign of weakness, but it's actually a sign of strength when you express yourself and tell someone that you need help. So know that you are not alone. Tips for managing diabetes distress. And I just want to keep this real short and simple, but it's really effective. To set realistic goals. Set achievable goals for blood sugar and lifestyle changes. Now, don't go too drastic, but you may want to reach that in some point, but make sure you follow the small little goals first. Like, for instance, maybe you're only drinking 3 cups of water a day, right? Ideally, maybe you want to do 8 to 10. But now you're doing 3. So your goal could be, okay, I'm going to start to drink 4 cups of water a day, right? And then you accomplish that. And then you set the next goal. Okay, now I can say maybe 6 cups a day. And then you eventually get to where you want to be. But make sure it's realistic goals, right? And number 2, seek support, which is really important. Connect with a therapist or a support group. And this is going to help you, again, another tip, helping you manage your diabetes distress, because this is where you can express yourself. Even if you're not taking care of yourself like you should, you can say that. Why? And then, like, I feel this way. And then the people there be like, I understand you. We're in this together. So you need that support. And then number 3, which is very important, is practicing self-care. So you need to prioritize activities that you like that can reduce stress, like walking or nature, or maybe you like to go swimming, or personally for me, I like dance. So I will take a dance class, and I also like nature. So I will go on nature walks. Maybe you want to, cuddle with your dog, or soak your feet in some water, or read a book, whatever that is. Just make sure you practice self-care and something that reduces your stress. Okay. And so the next one is when to seek professional help. So if you have persistent distress, if distress persists for more than a few weeks, then you definitely want to contact your primary care and mention that to them, that maybe you need to seek a mental health specialist, right? And if it also having an impact on your daily life, if the diabetes distress affects your ability to manage your diabetes. So, for instance, I had a patient who, she had diabetes for 10 years, and then she was suffering from diabetes distress for a while, and she stopped taking her medication for like 2 months. So then eventually she had to go to the ICU because she had diabetes ketoacidosis, which is very dangerous. And so this impacted her health, right? Because she wasn't able to manage and take her medication like she should. And so it impacted that part of her health, right? So that's why if it starts to do this, that means you're struggling emotionally and you need some support. So it would be wise to seek professional help. And then also if you're having suicidal thoughts, if you have thoughts of harming yourself or suicide, this is definitely a time to seek professional help. Call anybody on your diabetes care team. Mention to them, I'm having a hard time managing my diabetes because I'm depressed or have distress. Please, I need help. So, like, again, reaching out to someone for help is not a sign of weakness. It is a sign of strength and something that you deserve to have someone encourage and help you. Now, the key takeaways. Diabetes distress is a common experience among people with diabetes. Now, recognizing the symptoms and seeking support are essential for managing distress. Now, remember, you are not alone and help is available to live a healthy life.